Hi, I'm Cagney.
Hi, I'm Uriah, and today we'll be presenting a presentation on normal language development in children.
Okay, the purpose of this presentation. As children grow older, they tend to use their language skills for daily living. Language is the critical first step in literacy and the basis for learning to read and write. Provide information that will help mothers to increase normal speech and language development within their children. Explain the major language expectations during early childhood.
So, what is normal language development? It involves the ability to communicate for daily living, such as social relationships, as well as expressing feelings. And children also develop at their own pace. So, this is also known as milestones, and they help recognize if children are meeting the expectations at certain ages in early childhood.
Okay, these are some milestones. From birth to 2 months, the child should be able to focus on the speaker's voice and they cry if they're hungry, in pain, or angry. At 2 to 4 months, you should be listening for cooing sounds, which are vowel sounds, and laughter. For 4 to 6 months, they are able to vocalize to others. Squeals and yells emerge. At 6 to 9 months, they should be able to respond to their name, use gestures for communication, like a wave, and babble, sing mama. At 10 to 12 months, jargons with different sound combinations are acceptable. Gives objects to others upon request. Begin to use the first words. At 12 to 18 months, they begin to follow commands, use several single words, and communicate with the combination of words and gestures. And that's according to Cincinnati's Children 2020, Vicki A. Reed.
Here are some more milestones. At 18 to 24 months, they should begin to use 2 to 3 word combinations and understand complex commands. They also should begin to use more speech sounds such as s and sh. By the age of 2 to 3 years old, they should explain why and how to those type of questions. And they should also use phrases and short sentences for communication. At the age of 3 to 4 years old, they use longer and more complex sentences. They tell stories from the past, has fluent speech that is understandable to all listeners, although grammar errors are sometimes noticed. An example is feats, and that's according to Cincinnati's Children and Vicki A. Reed.
There are many strategies to develop normal speech, and some of them are to check to see if the child can hear, pay attention to your child looking at you when you talk, or if he or she turns to the noises. Use short words and sentences. Continue to teach them new words. If they don't understand the word, explain to them. Talking about what you are doing that day. An example of this is mommy is washing her hair or mommy is cooking. Talk to them about where you're going, what you do there, or who or what you'll see. An example of that is we're going to grandpa's house, or grandma has a dog. Teach your animal, teach animal sounds. Example, a dog says roof. Teach your children to imitate actions. An example of that would be waving bye-bye or blowing a kiss and clapping. Read to your child every day with a simple story and ask what was their favorite part. And let your child tell you how to do something. And that is according to ASHA 2020.
So these are some questions that you may have. The first question is, my 6-month-old baby is not cooing or responsive to his name being called. Should I be concerned? So as previously stated, by 6 months, your baby should be cooing and responding to his name. It's best that you see a specialist so that they can be assessed properly. The second question that one may have is it beneficial to read to the baby while they're still in the womb? And the answer to that question is yes. It's very beneficial to read to your baby while in the womb because they can pick up newer words and understand their meaning in their earlier life. And the last question that someone may have is, how can I further encourage my toddler's speech development? And the answer to that is you can further encourage your toddler's speech by simply following some of the strategies stated previously. Examples are reading to your child, talking about where you're going, continue to teach them new words, and furthermore.
In conclusion, normal speech language development milestones are useful for both SLPs and parents to have a better understanding of whether the child is making progress over the period of time. To help your child develop normal speech language, you should do your part to ensure that they are engaged in a daily activity, such as reading them a book, or making brief conversation, then gradually making them more complex over time. It is important to never be ashamed of your child's progress. Always remember to encourage and to support them. There are more resources that can further improve your child's speech language development outside of the home setting. An example of that would be speech therapy. And these are our references. And thank you.
Thank you for joining our presentation.
Thank you. Good night.